Phlebotomy Chapter 2, Venipuncture Equipment. Coagulation and hemostasis. Forming a blood clot when injury occurs. Lysing a blood clot when injury is repaired. Coagulation involves blood vessels, platelets, and coagulation factors. Coagulation factors. Stage 1, primary hemostasis. Stage 2, secondary hemostasis. Stage 3, clot stabilization. And Stage 4, fibrinolysis. In primary coagulation, platelets begin to adhere to an injury. 2. In coagulation cascade, the intrinsic pathway and the extrinsic pathway both lead to the common pathway. 3. Fibrin stabilizing and clot retraction. Clotting factor 13 creates a cross-linked fibrin meshwork. Fibrinolysis, fibrin degradation products. Arterial blood. Bright red in appearance. Pressure must be applied to the site for 3 to 5 minutes after an arterial puncture. Used for blood gas determinations. Must be specifically trained to perform. Venous blood. Easier to stop bleeding. Obtained from the vein. Specimen of choice. Reference ranges established from venous blood. Capillary blood. Smallest blood vessels. Dermal puncture collection. Bleeding is easily controlled. Mixture of arterial and venous blood. Note on the requisition form whether blood is collected by dermal puncture. Whole blood consists of erythrocytes, leukocytes, and platelets. Use anticoagulated specimen. Complete blood count and blood typing. Plasma is the liquid portion of blood. It is unclotted and contains fibrinogen. It is obtained from an anticoagulated specimen. Serum, clotted blood, does not contain fibrinogen. Use a clot tube. Anticoagulants. Calcium-binding anticoagulants are EDTA. 2 types of EDTA are powdered dipotassium, or K2, and liquid tripotassium, or K3. Sodium citrate, potassium oxalate, sodium polyenethyl sulfonate, or SPS, which is used in blood cultures. Thrombin inhibition, heparin, sodium, lithium, or ammonium. Laboratory protocol specifies the type of anticoagulant used. Serum and plasma appearance. Icteric specimen appears dark yellow and has increased bilirubin. Lipemic specimens cloudy, appear milky, and have increased lipids. Hemolyzed specimens appear pink-red, indicates erythrocyte destruction. Phlebotomy tray helps to prevent unnecessary errors during blood collection. Should be placed on a solid surface. Bring only the equipment needed directly to the patient's bed. Emptied and disinfected once a week. Phlebotomy workstations. Mobile workstations have replaced the traditional phlebotomy tray in most facilities. Can accommodate phlebotomy trays, sharps containers, hazardous waste containers, storage drawers, and shelves. Can be wheeled around the hospital and up to the patient's bedside. Drawing stations. In outpatient settings, a blood drawing chair is used. Blood drawing chairs have an armrest that locks into place to provide for arm support and protection if the patient faints. Reclining chairs or beds are available for patients who feel faint or are ill. Infant cradle pads or portable infant phlebotomy stations are available for infants. Evacuated tube systems. Most frequently used for venipuncture. Eliminate transfer of blood. Minimize exposure to blood. 3-part system. Needles. Multi-sample, hypodermic, and winged blood collection set. Sterile, disposable, one-time use. Vary by gauge. Color-coded caps. Needle length varies. Hypodermic and multi-sample are 1 to 1.5 inches. Winged blood collection sets are 0.5 to 0.75 inches. Length of needle depends on depth of vein. Needle gauge refers to the diameter of the bore of the needle. Standard gauge is 21 or 22. 20 gauge needles not recommended for routine blood collection. Issues with patients on blood thinners. Use of 25 gauge needles. Needle is in the vein longer. The tube fills more slowly and microclots form. Hemolysis occurs more frequently. Use of 23 gauge needles. Only used on children and patients with small veins. Small volume partial evacuated tube must be used. Needle structure consists of a bevel, shaft, lumen, and hub. Visually examine all needles for any structural defects. Do not use defective needles. Never recap a needle after the shield has been removed. Multi-sample needles. Needles used with an ETS are threaded and have a beveled point at each end. Retractable rubber sheath prevents leakage of blood as tubes are changed or removed. Never activate the venipuncture needle pro shield with your thumb. Always activate the needle guard against a hard table surface. Needle holders. Made of clear, rigid plastic. Made with or without safety features. All holders must be discarded with the used needle attached per Occupational Safety and Health Administration, or OSHA. Tube holder must have a safety device if the evacuated tube needle does not have one. Primary cause of failure to obtain blood is loss of tube vacuum. BD1 use, venipuncture, needle pro, and vantage point are the different types of needle holders. Safety tip. Become thoroughly familiar with the operation of your needle safety system prior to performing blood collection. Needle disposal systems. Syringes with needles attached. Winged blood collection sets. Holders with needles attached. Safety shields activated. Sharps containers should never be overfilled. Never manually recap a needle. Sharps disposal containers are rigid, leak-proof, with biohazard labeling. Collection tubes are available in a variety of sizes and volumes ranging from 1.8 to 15 milliliters. Evacuated tubes contain a pre-measured amount of vacuum. Glass and plastic. Rubber stoppers. HemoGuard closures. Color coding. Identifies the type of anticoagulant or additive. Each department has a specific tube requirement. Tube label includes the additive, drop volume, and expiration date of the tube. Loss of vacuum will cause the tube not to fill to the required level. Causes of loss of vacuum include dropping the tube, opening the tube, improper storage, manufacturer error, and expired tube. Premature advancement of the tube on the back of the needle, and bevel of the needle out of the skin. Principles of color-coded tubes. Indicates the type of specimen that will be obtained when a particular tube is used. Tests are performed using plasma, serum, or whole blood. The presence of preservatives, inhibitors, clot activators, or barrier gels may be required. Whole blood or plasma specimens are collected in tubes containing an anticoagulant. Prevent clotting by binding calcium or inhibiting thrombin. EDTA, citrates, and oxalates work by binding calcium. Heparin inhibits the formation of thrombin. Gently invert tubes 3 to 8 times immediately after collection. Correct blood to anticoagulant ratio is necessary for accurate test results. For short draws, use a partial draw collection tube. Do not transfer blood between tubes containing different anticoagulants or additives. Lavender top. Anticoagulant K2 or K3 EDTA. Sample type, whole blood. Invert 8 times. Primary test, CBC. Inhibits platelet clumping. Maintains cellular integrity. Does not interfere with staining. Clinical and Laboratory Standards Institute, or CLSI, recommends spray-dried K2 EDTA for hematology tests. Do not use for coagulation tests. Problems occur with underfilled EDTA tubes. Pink top, anticoagulant K2 EDTA. Sample type whole blood, invert 8 times, designated for blood bank tests. Special label required by the AABB. White top, anticoagulant K2 EDTA with gel, PPT. Sample type, plasma. Invert 8 times, used for molecular diagnostic tests. Light blue top, anticoagulant sodium citrate. Sample type, plasma. Invert 3 to 4 times. Primarily used for coagulation tests. Preserves coagulation factors. Blood to liquid sodium citrate ratio 9 to 1. Adjust for high and low hematocrit levels. Incompletely filled light blue tubes are always rejected by the lab. Discard tube must be used to prime the line when using a winged blood collection set. Black top, anticoagulant sodium citrate. Blood to liquid anticoagulant ratio 4 to 1. Sample type whole blood. Invert 8 times, used for Westergren sedimentation rates. Specially designed tube and holder. Green top, anticoagulant, heparin. Sample type, plasma or whole blood. Invert 8 times, used for chemistry tests. Avoid anticoagulant interference with particular tests, sodium, NH4, and lithium. Heparin interferes with differential staining. Green PST, anticoagulant, lithium heparin. Additive, separation gel. Sample type, plasma. Invert 8 times. Separate plasma from cells. Ideal for potassium tests and other chemistry tests. Vacuette manufacturer, green with yellow circle. Lime green top, anticoagulant, lithium heparin. Additive, mechanical separator or flexible elastomer. Sample type, plasma. Invert 8 times. Separates plasma from cells. Ideal for chemistry determinations, therapeutic drug monitoring, and zinc testing. Gray top, anticoagulant, potassium oxalate or sodium 2 EDTA, available without anticoagulant. Additive, antiglycolytic agent, sodium fluoride. Sample type, plasma or serum. Invert 8 times. Used for glucose, lactic acid, and blood alcohol levels. Sodium fluoride interferes with some enzyme tests. Potassium oxalate distorts red blood cell morphology. Royal blue top, plain with clot activator, sodium heparin or K2 EDTA. Sample type, serum or plasma. Invert 8 times for plasma, 5 times for serum. Specially formulated rubber stoppers. Chemically clean tubes. Used for trace elements, toxicology, and nutrients. Tan top, anticoagulant, K2 EDTA. Sample type, plasma. Invert 8 times. Contains less than 0.01 micrograms per milliliter lead. Used for lead testing. Yellow top, blood bank, acid citrate dextrose. Preserves red blood cells. HLA phenotyping, DNA and paternity. Microbiology, sodium polyanethyl sulfonate or SPS. Blood cultures, aids microorganism recovery. Invert 8 times. Sample type whole blood. Light blue or black top, anticoagulant, sodium citrate, gel. Cell preparation tube, blood monitor molecular testing. Sample type plasma. Invert 8 times, used for molecular diagnostics. Red or green top, anticoagulant, sodium heparin or gel. CPT. Blood molecular testing. Sample type plasma. Invert 8 times, used for molecular diagnostics. Orange top. Additive, thrombin with gel, RST. Sample type serum. Invert 5 times, clots in 5 minutes. Used for stat serum chemistry tests. gold or red-gray top. Additives: silica clot activator, gel, SST, sample type serum, invert 5 times, allow to clot for 30 minutes, used for chemistry tests. Vacuette, red with yellow circle, do not use for immunohematology or some immunology tests. Red plastic tube, additive silica clot activator, sample type serum, invert 5 times, allowed to clot for 30 minutes, used for immunology, chemistry, and immunohematology testing. Red glass tube, no anticoagulants or additives, no inverting required, sample type serum, allowed to clot for 60 minutes, used for chemistry, immunology, and immunohematology testing. Clear and red light gray top, no additives or anticoagulants, used as a discard tube. Centrifugation of incompletely clotted SSTs can produce a non-intact gel barrier and possibly cellular contamination of serum. Order of draw: prevents specimen contamination by tissue thromboplastin, anticoagulants, additives, and microorganisms. Tissue thromboplastin affects coagulation tests. Transfer of EDTA to a tube affects calcium testing. Transfer of sodium citrate or potassium oxalate to a tube affects electrolyte testing. Blood collection tubes must be held in a downward position to ensure that the tubes are filled from the bottom up to avoid transfer of anticoagulants between tubes. Sterile specimens, blood culture bottles, and yellow SPS. Light blue, sodium citrate. Serum tubes, red-gray, gold, red plastic or glass, orange, royal blue with clot activator. Green and light green PST, royal blue with heparin. Lavender, pink, white tan, royal blue with EDTA. Then gray, and then yellow ACD. Syringe system, used for small, fragile veins. Suction pressure on vein can be controlled. Coordinate syringe size with volume of blood required. Consists of a barrel and a plunger. 2 to 20 milliliter syringes are commonly used for venipuncture. Syringe needles, individually packed, sterile, color-coded per gauge. 21 to 23 gauge. Needle protection devices are available. Blood transfer devices. Must be performed quickly to prevent clot formation. Use blood transfer device. Discard entire assembly in Sharps container. Follow the same order of draw as for the ETS. Winged blood collection sets. IV fluid infusion. Very small or fragile veins. Pediatric and geriatric specimens. 21 or 23 gauge needles. Wings are used for holding the needle during insertion. The flexible plastic tubing attached to the needle can be attached to the IV setups, syringes, or evacuated tube holders. Winged blood collection sets have built-in safety devices. Always hold the apparatus by the wings, not the tubing. Use a clear discard tube to prime the line when collecting blood for coagulation tests. Fill the aerobic blood culture bottle first when using the winged collection set. Tourniquets. Make it easier to locate a patient's vein. Disposable, non-latex strips, nitrile or vinyl. Blood pressure cuffs. Maintain pressure just below the diastolic blood pressure number. Venoscope. Helps locate veins that are not easily visible. Infant, pediatric, or elderly patients. Highlights the vein by absorbing the light. Vein stands out as a dark line. Gloves. OSHA and Centers for Disease Control, CDC, Healthcare Infections Practices Advisory Committee mandated. Gloves must be changed after each patient. Non-latex or powder-free. Antiseptics. 70% isopropyl alcohol is used for routine venipuncture. Iodine chlorhexidine gluconate is used for blood cultures. Gauze bandages. 2x2 gauze pads, applied pressure to puncture site. Cotton balls are not recommended. Bandages or tape are applied after bleeding stops and removed after 15 minutes. Latex-free. Self-adhesive gauze. Short draws. Excessive dilution by liquid anticoagulant. Underfilled sodium citrate tubes cause a falsely lengthened APTT result. Distortion of cellular structures. Underfilled EDTA tubes cause red blood cell shrinkage. Avoid manual filling of additive tubes. Chapter 2 from the book. Key terms. Additive. A substance such as an anticoagulant, clot activator, or preservative added to the blood collection tube. Anticoagulant. Substance that prevents blood from clotting. Antiglycolytic agent. Substance that prevents the breakdown of glucose. Antiseptic. A substance that inhibits the growth of microorganisms and is used to clean the skin. Bevel. Area of the needle point that has been cut on a slant. Clot activator. Clot promoting substance such as glass particles, silica, and cellite. Evacuated tube. Blood collection tube containing a pre-measured amount of vacuum. Hemolyzed. Destruction of red blood cells. Hemostasis. Stoppage of blood flow from a damaged blood vessel. Holder. Plastic apparatus that attaches to a multi-sample needle or winged blood collection set. Hub. The part of the needle that attaches to the syringe or blood collection holder. Hypodermic needle. Type of needle that attaches to a syringe. Icteric. Appearing yellow because of the presence of increased bilirubin. Lipemic. Appearing cloudy white from increased lipids. Lumen. Cavity of an organ or tube, such as a blood vessel or a needle. Multi-sample needle. Type of needle that attaches to a holder to collect multiple blood collection tubes. Plasma. Liquid portion of unclotted or anticoagulated blood that contains fibrinogen. Plasma preparation tube. Type of EDTA collection tube that contains a polymer gel that separates blood cells from the plasma when centrifuged. Plasma separator tube. Type of heparin collection tube that contains a polymer gel that separates blood cells from the plasma when centrifuged. Rapid serum test tube. Type of blood collection tube that contains thrombin and a polymer gel that clots within 5 minutes. Serum. Clear yellow fluid that remains after clotted blood has been centrifuged and separated. Serum separator tube. Type of collection tube that contains a polymer gel that separates the blood cells from the serum when centrifuged. Winged blood collection set. Type of needle and tubing apparatus attached to plastic wings that can connect to an evacuated tube holder or syringe. Hemostasis is the process of forming a blood clot to stop the leakage of blood after an injury to a blood vessel and then lysing the clot when the injury has been repaired. A complex coagulation mechanism that involves blood vessels, platelets, and the coagulation factors maintains hemostasis. The coagulation cascade includes an extrinsic pathway that is activated by tissue factor, also called thromboplastin, outside the bloodstream, and an intrinsic pathway that is activated by coagulation factors circulating the bloodstream. In stage 1 of the coagulation cascade, also called primarily hemostasis, blood vessels and platelets respond to an injury to a blood vessel. Blood vessels constrict to slow the flow of blood to the injured area. Platelets become sticky, clumped together, or platelet aggregation, and adhere to the injured blood vessel wall, platelet adhesion, and form a temporary platelet plug. In stage 2, or secondary hemostasis, the coagulation cascade initiates the formation of fibrin strands to strengthen the platelet plug by forming a fibrin clot. In the coagulation cascade, one factor becomes activated, which activates the next factor in a specific sequence. The two pathways, extrinsic and intrinsic, come together to create the common pathway and complete the cascade. In stage 3, fibrin stabilizing and clot retraction, The last factor in the coagulation cascade, factor 13, stabilizes the fibrin clot. This produces retraction of the clot. In stage 4, fibrinolysis, after the injury to the blood vessel has healed, the process of fibrinolysis degrades the fibrin clot into fibrin degradation products, or FDPs. Chapter 2 Review Questions. 1. The possibility of hemolysis is increased with the use of a 25-gauge needle. 2. Pushing an evacuated tube through the stopper puncturing needle before entering the vein will result in failure to obtain the specimen, as it will completely get rid of the vacuum in the tube. 3. After completion of the blood collection, the holder is discarded in the sharps container with the needle attached. 4. Failure to gently and immediately mix an anticoagulated specimen will cause clot formation. 5. Light blue stopper tubes will automatically be rejected by the lab if it's not filled to the correct volume. 6. Lavender stopper tubes do not contain a separation gel. Gold, light green, and white stopper tubes do contain a separation gel. 7. You receive a requisition form for the following tubes: light blue, lavender, green, and red. What is the correct order of draw? Light blue, then red, then green, then lavender. 8. It's recommended to use a blood transfer device when transferring blood from a syringe to an evacuated tube. 9. The recommended antiseptic for routine venipuncture is isopropyl alcohol. 10. Using evacuated tubes past their expiration date can cause incompletely filled tubes. For further study, you cannot use a lavender tube to collect blood for a prothrombin time test because EDTA interferes with factor 5 and the thrombin fibrinogen reaction in the coagulation cascade. An SST is preferred over a red stopper tube for chemistry tests because the gel in an SST slides up to separate the cells from the serum, which prevents cellular contamination of the serum. The fluid obtained after centrifuging a tube that contains an anticoagulant is plasma. This fluid contains fibrinogen. Case study. A CBC should be collected in a lavender stopper tube, and electrolytes should be collected in a green gel separator tube. Green stopper gel separator tubes would be collected first, and then the lavender. Using a 25-gauge needle can hemolyze the blood, which can cause increased potassium levels in the specimen. Mixing the specimen too vigorously after collection can also hemolyze the blood, causing increased potassium levels. A light blue stopper tube must contain a 9:1 ratio of blood to anticoagulant. Underfilled light blue sodium citrate tubes are always rejected by the lab. There is 0.5 milliliters of air in the tubing of a winged blood collection set. The air in the line could cause a light blue tube to not fill to the correct level. Always use a discard tube to prime the line before attaching a light blue stopper tube.